All right, good afternoon again. Right now we are at our Bariatric Friday session. Today is October 11, 2024. Today in our studio, we have Dr. Gail Wynn. I think earlier I was just saying that I was on mute, but I'm going to say it when I'm on in air. So on air, Dr. Gail Wynn is one of the best female surgeons, I would say, in the world in bariatric surgery, and maybe in general surgery as well. So she's in our studio. She's going to turn her camera off and going to join me, and we are going to just on the Zoom, if you can click on the camera. All right. So, yep, no, you're fine on because we are using my camera for the mic, so that's good. Well, this is interesting to have you here because we do this through Zoom. I do a lot of sessions with Dr. Erkan, and then you have done sessions with me mostly on the support group, and we want to actually take a different route on our topic today, and then we are going to talk about social stigma and sexual well-being, and morbid obesity impact on these individuals who are fighting morbid obesity and how bariatric surgery is able to help. But before we start with the topic, if you can give us the background on bariatric surgery and qualifications and what we do and how we prep the patient for the surgery, and then we'll start with the topic after that.
Okay, sounds good. So I'm Gail Wynn, and I'm a bariatric surgeon. I've been doing this since 2001. Dr. Erkan and I started the program here in Northern Delaware back then. We started at Christiana, brought it to St. Francis, and also to our surgery center. We've done probably close to 10,000 surgeries over the past 23 years, so we're probably the most experienced in bariatric surgery. And we are fellows of the American Society of Bariatric Surgery, as well as very qualified in treating obesity medicine as well. So when we look at bariatric surgery, bariatric surgery, you just don't come in and say, I want weight loss surgery, and then you would go in and have surgery the next day or the next week. There's a process that involves us first meeting you, determining whether you are a candidate for weight loss surgery. And then if you are, we have you get educated. We have you see a dietitian. We have you see a psychologist. Sometimes we have you see a cardiologist. We do a full metabolic panel on you to make sure that we correct any metabolic deficiencies. And if we need to, we also have you see a pulmonologist or possibly a hematologist, depending on your medical issues that come along with it. And then we also do an endoscopy on you where we sedate you, put a scope down, look at your stomach to look at the state of your stomach and to see if you have any problems that would warrant us to fix it before we perform weight loss surgery on you and alter your anatomy. Weight loss surgery is kind of like at the forefront right now. It's been around since like the 1950s. It's been perfected since the 1990s when it was being done laparoscopically. And now we are, doing weight loss surgery on probably only about 1% of the population. We also now have these new medications that are out to help people lose weight from a medical standpoint, and they have been showing a lot of promise, but it hasn't eliminated weight loss surgery. Weight loss surgery is still very viable and still even the number one way to lose weight when you are 100 pounds overweight or more, or BMI 35 with medical problems like diabetes, high blood pressure, sleep apnea. So, Mal asked me to come here today to talk about the problems that are associated with being overweight when you're a female. And
so the reason we want to do that is because we have 85% of our patients. I just recently looked at those numbers for the last 3 years. 85% of our patients who have bariatric surgery are female patients. So that's why when we were covering this topic under social stigma and sexual well-being, we were kind of overall approaching that more on the sexual side than the actual sexual health versus like the menopause is one of the big issues, especially when 85% are female. So before we get into the menopause part of it, from the individual standpoint and from the clinical standpoint, I want to kind of get the background from you and your take on social stigma and what you have seen with your patients. You have seen so many patients, and I wasn't, trying to be unreal when I said you are probably one of the best surgeons right now in the United States for sure. So in bariatric surgery, but this means you also have seen so many patients. Not all of them went through the surgery, so then you probably have a great understanding of social stigma on these individuals. So if you can kind of talk about that a little bit.
Sure, absolutely. So one of the biggest social stigmas for women, especially overweight women, is things like they feel like they are discriminated against. Things like they don't get jobs that they apply for. They don't get raises that they ask for. They don't get moved up in the world of whatever career they're in because they're overweight. And even just something as simple as they are walking through a door and someone opens the door for them. They said that never happens when they're morbidly obese or overweight. But when they lost the weight, all of a sudden people started paying attention. People were being nicer, kinder, talking to them a little bit more, like say you're in the line at like a checkout counter. When you are walking next to someone, they're more likely to talk to you than when they were overweight. Things like that that they started picking up on. And then the other thing is how they feel about themselves. Their self-esteem is really low, especially when they're overweight. And unfortunately, our society judges people by how they look. So the social stigma is so much greater for women than it is for men. For a man to be overweight, that's okay. But for a woman to be overweight, they're judged by that. And that makes it a little bit difficult, as well as it's very unfair.
So, and this is also impacting them on the psychological side of it. So then a lot of patients that we have seen, they do have anxiety and depression related issues, right?
That's correct.
So now today we want to kind of focus on the specific on menopause. Now, not many people have a good understanding of what happens when people go through the menopause. So when I have this menopause discussion, of course, Dr. Erkan is a clinician, so it's not him being a man doesn't matter. But the two men talking about menopause, I don't think it's fair. So I don't know if you remember one of our state senators, Nicole Cora, she was actually our guest, and before she joined us, she said, "I'm going to talk about menopause." Okay, so and then we have Dr. Belisana with me and Donna Dunkel. I think there was one more person, but we stopped talking about menopause, and she told me, "Okay, so you don't know anything about this, so don't talk about it." So she, right on the live streaming. So I guess maybe just on the menopause itself, what's happening for those individuals and how morbid obesity is making this more complicated and how we can help them with the bariatric surgery.
Sure. So when you are undergoing menopause, of course, Kemal picks the over 55 female to discuss this. When you're undergoing menopause, what happens is your estrogen levels go down. And when your estrogen levels go down, there's a lot of other things that happen. Things like decreased interest in sex, vaginal dryness, muscle wasting, hair changes, skin being a little bit more lax. And when that happens, you start to also gain weight because your estrogen levels are low. And what happens when you start gaining weight is you build up more fat cells, you're losing more muscle, and it kind of becomes this vicious cycle of more inflammation because of increased fat cells. you also start producing even less estrogen. And so what happens is you end up being in a situation where you start gaining weight. Especially, we've been doing this for like 23 years. So we see our patients who we operate on when they're in their 30s and now in their 50s, they're still eating healthy, they're still exercising, but they're gaining weight and they don't realize why. Well, it's because the hormonal changes that occur. It also changes your sleep patterns too. And we know that becoming overweight is also associated with poor sleep. So all of these things kind of contribute to gaining weight back. One of the best ways to counteract this is, if you're a candidate for hormone replacement therapy, is to go on hormone replacement therapy. Because it counteracts hot flashes, it counteracts the stress incontinence, it counteracts just the tiredness, the sleep problems that you have with menopause. The other thing that helps is improving your muscles and your muscle strength. So doing more resistance training and weight training versus cardiovascular training, because the more muscle you build, the more you counteract kind of the detrimental effects of menopause and loss of muscle mass.
So now with the we know that during the menopause, prior to that, many people are already gaining weight, right? So but if they have morbid obesity, that weight gain is even more. Now, average menopause age, is it like 50 to 55 maybe?
Yes.
More like most common.
Yes.
So, and that's probably a lot of our patients are in the 40 to 55 range. Now, how is bariatric surgery helping the situation?
So it kind of breaks that cycle. It breaks the cycle of, you know, I'm overweight, I have this big giant fat mass, and I am producing estrogen, but now I'm not producing estrogen. And so now I'm gaining more weight and my fat mass is actually increasing. And so what it does is it kind of changes how you eat, because you are unable to eat a lot. You have a smaller stomach, or you may have a bypassed intestine, so that allows you to absorb less. So because you're profoundly eating less, that helps you kind of overcome your body's desire to try to stay at a certain level, or what we call the protected fat mass that it's trying to do. The other thing that happens is when you are losing weight with weight loss surgery, there's all these other gut hormones that we just don't completely understand that also play a factor into changing our hunger, changing our level of satiety or fullness, changing our desires to eat. So that also plays into it. So there's the anatomical aspect of weight loss surgery, but then there's also a gut metabolism aspect of weight loss surgery that overcomes this desire of your body to gain weight with menopause. And when you talk to GYNs, I remember reading a book called The Hormone Reset, because when my patients were aging, they were all coming to me saying, how do I solve this problem? Like, I'm in menopause and I can't stop gaining weight. So I went to my GYN friends. I said, what did they do? How did they solve this problem? And they're like, the only thing that you could do is eat profoundly less. How do you tell your patient that's already eating hardly anything to eat even less than what they're eating? So when you are, over 50 and you're trying to lose weight, weight loss surgery will help you get down, because it helps you eat profoundly less, makes you feel full even when you're eating profoundly less, and it kind of changes that thermostat of your body to stay up here to being at a new level, which is down here.
So I think, I always kind of maybe fun of my own situation with the heat and hot flashes, that I have to have my own AC unit to stabilize my own body heat. But I think one of the worst symptoms is the hot flashes. And weight loss surgery, bariatric surgery is also helping with those, because I think this is related to someone being heavier than they're supposed to be, right?
Right.
So have you seen those real changes reported to you from the patients that, hey, this is what was happening now, here where I am, like from the patient progress standpoint, the outcome, what have you seen lately from the patient side?
So yes, there is a reduction in hot flashes, but there's also a reduction in just heat production too. So if you think about the fact that you lose 100 pounds in a year, you also lose, a giant fur coat, right? So your metabolism also improves too, but in the process, you lose all this extra insulation that helps you not feel so hot all the time. And then when you have the hot flashes, those are also altered. Sometimes we could delay that feeling, like even, several years with weight loss surgery because of the change in their estrogen production.
So we discussed the depression and maybe psychological impact overall, just being having morbid obesity, menopause, as I was giving an example from our state senator associate, you don't know what it is, so let's not even, this is like I asked her how we can actually help from the men's side. She's like, just don't ask any questions. So, but it is my job right now to ask questions. Are there different things that we can do, the patient families, their support group, their immediate friends, we can do things differently to help those individuals who are going through the process while they have morbid obesity and now they're going through menopause. And even if they sign up for the surgery, that's going to take some time to see the results. What can we do, the individuals can do to help that person?
So I think patients understanding support. So you said it yourself, you have your own AC. It's nice when people try to understand or just demonstrate that, okay, I understand you're going through menopause. Let me just step back, accept that you're cranky, accept that you're going to be mean. I had a patient who was a man the other day who told me that he woke up in pain and he wasn't feeling well and he was hot, and he told his wife, stay away from me, Warren. I am going through menopause right now. And so I feel like that's my message to family members, is just be patient and understanding and understand what they're going through. Because sometimes those hot flashes could be pretty severe. When you lack sleep, you're cranky, you're irritable. Sometimes this could lead to depression, anxiety, and just difficult with, daily communication with your family. So just be patient and understand.
So going back to the overall impact, we know that I think you and I, we did one of the sessions where we talked about the resolution of comorbidities. And so this could be one of the comorbidities. I guess if patient was at that point, depression is one of those where we see a lot of resolutions, diabetes, cardiovascular hypertension, sleep apnea. All those are kind of like, they're bad siblings of morbid obesity, and most of them are originated from morbid obesity, and which is one of the issues that we discuss in these sessions to change the understanding of obesity, and this is not being some lifestyle choices rather than it is a biological issue with the genetics and all the other things. So many people don't understand that. So in terms of the actual, the patient coming back, they lost 80, 100 pounds. I have a couple of your patients, they lost 100 pounds in 6 to 8 months. That kind of like, I want to get a good understanding of what they feel when they see that, even if they don't have the menopause, right? So like, can you actually really feel or relate exactly what they're going through now? I'm saying this because you are doing a lot of activities. Sometimes I can't keep up with what you do. And I'm like, how is she able to do it with 3 kids and full-time surgeon? And you see most amount of patients, you do most amount of surgeries, but you keep yourself so active. So that's why I'm saying that maybe we may not be able to relate to that specific, but you can feel
Well,
it,
I
right?
think I could relate to it
Okay.
because I think a lot of it is sound mind, sound body, right? So if you are eating healthy, if you're staying active, you're going to feel good. You're going to feel good about yourself, and you're going to be able to do more. And my patients that have lost 100 pounds, guess what they tell me? That they're active. They're doing things that they didn't do before. They're walking more. They're able to do things with their kids that they weren't able to do before. They have more energy. They're cleaning things out. They're not sitting on the couch so much anymore because now they can move around. So that it really improves health. And when your health is improved, guess what? Your mind is improved. Your emotions are improved. You're psychologically feeling better. So you feel like there's so much more you could do. There's so much more that you could achieve. And those patients that have lost like 100 pounds, they're the ones that come back to me and said, hey, I got my raise. Hey, I got my job that I wanted. Hey, I got my promotion, because all of a sudden they have this confidence and this self-esteem that they didn't have.
The confidence, right? So the because we focus on the well-being of the female side of this, but there's also female side of the actual sexual activity, and I think with the confidence, when we cover this from overall sexual well-being side, the physical activity of sex has a lot of impact on the individual. So it's in some cases better than medicine. It's better than any other things. So, but then if they are not able to have sex or whatever it is, then there are so many other implications of that as well. Because healthy being, this is one of the needs that we have, and I think that confidence goes with that. Where some of them don't even want to be naked in front of their partners, so or they think that they're not attractive, so they don't want to even try. So many different things that also goes with this. But I think we were able to highlight the main issues. So because menopause is a huge problem, but then we know that with morbid obesity treatments, which is the most effective one right now, is the bariatric surgery. So we can actually educate our patients. Hopefully they're watching this, and I know they're watching because we get a lot of feedback from them. Taking actions early on before the problem hits home. So then if you can take certain actions, proactive actions, so then you have your appointment with your surgeon. And even if you feel like you are not going to go through the surgery, there are now a lot of other medications that's available, which was not available 7, 8, 9 years ago, right?
So not even 5 years ago.
Right. So this used to be only one option that we had. The fentanyl, I guess, was the only one that I know, but now there are several different ones. How is our utilization of the weight loss medication in our practice right now?
So we try to integrate the medications in our practice. We use it sometimes for people that are a little hesitant to have surgery to try to get them to lose weight. We also use it for people as an adjunct, especially when you have a very high BMI to start, to use a combination of surgery as well as medical therapy to help them reach their weight loss goal. People that are struggling after they've had surgery years later, we use that as well for helping them kind of reattain their goal and get back on track. So medications are not exclusive of surgery. We could use them as an adjunct to surgery, as well as use them in areas where people don't want to pursue surgery.
So I guess not just for morbid obesity, but any of our health-related issues, the best thing that we can do is diagnose those issues early enough so that we can take actions. Our healthcare providers, yourself, others, primary care, other specialties. That's one of the things that we do from United Medical ACU, where we are able to identify patients who may be going through certain troubles with high BMIs or high A1C, sleep apnea, and like even now these days, kidney failure with the GFR being lower than 89, with level, stage 2, stage 3. A lot of those are going through undiagnosed until we actually push through these blood works and other things. So the best, I guess we can, best probably advise that we can tell people, take in charge of your health and well-being. This can be, again, anything from sexual well-being to just being a healthy individual. And this requires effort, and effort just like us. We do this even if we don't have morbid obesity. Like today, I had 2 rhubarb puddings after my 17-hour fasting, and everything else. So it's what 3:35, and the entire time since 8 p.m. last night, 8 p.m. yesterday, it's that's all I had. So, and I do that because I have to, and then because I also walked this morning maybe 5,000 steps before I get to the office. So these are different things that we can do, but some individuals are not as lucky as we are. So even if they do some of these, they may not see the results, or they are not able to do what we are doing because there is a chronic problem, chronic illness that we have to really address, and it needs to be discussed. So don't be shy, come to our offices. We have 5 nutritionists on site available. It's also very low utilization prior to the ACO, where now we are keeping them busy, because a lot of people didn't understand how nutritionists, dietitians can help, and then that's part of our program. So I think we have all the right resources available for our patients. Like we have a bariatrician on site in our team. Not every program has those individuals since they're not available, readily available. So I think not only we can help, but we are probably the best place to get that help. Please reach out to us, and hopefully we can be part of your journey and help you to be healthier and better than where you were before. So Dr. Wynn, thank you so much for joining us. And thank you again for coming to the studio, because this is a little bit different than the Zoom, as you can tell. So I'm glad that you were here, and we appreciate your support and your willingness to be with us for these events. So thank you so much again.
Thank you.